Hello everyone. Today we'll be talking about body contouring, specifically skin tightening, cellulite, what causes cellulite, and also fat reduction treatments that are out on the market today and what we have at LifeScape. I'm joined actually by Dr. Wilder. We're just being physically distant, so to do this video we've actually gonna be kind of pairing off back and forth, and we'll be taking some Q&A at the end of today's segment. But first I wanted to jump right in and talk about cellulite. What is cellulite? Why do we have cellulite? Why do women get it more than men? And I know it's really frustrating and it's really common for most women to have it, and what we can do about it. So there's different grades of cellulite that we have. We usually, when you come in for a consultation, we usually grade it by cellulite 0 all the way up to grade 3. So if you have, if you're wondering what grade you are, grade 0 is essentially you have a completely smooth surface when you're lying down and standing up, but if you pinch it, you have just a little bit of wrinkling. So that is what makes the difference in that grade 0. Grade 1 is actually when you have a smooth surface while lying down and standing. But if you do the pinch test, right, you do that little pinching test, and then you'll see the dimpling in that pinch test. And then grade 2 is when you have smooth surface when you're lying down, but when you're standing up, you might see the dimpling effect, okay? Grade 3 is when you have cellulite or that dimpling effect when you're lying down or standing up. And this is important because this is going to determine for us, the practitioners, whether you're going to be a good candidate and have realistic expectations of what the technology in the office can do. There's multiple reasons why we have cellulite. You'll find that it is more common in women than men, and they find that that's because of hormones. Also, sugar plays a huge role, is what they've found out, and genetics. And so there are ways that you can combat it naturally, okay? So watching your diet, obviously, exercise, having great muscle mass in those areas, and then also there's other things that you can do, like dry brushing, lymphatic drainage massage works at home as well. So when you combine all of these things together with the technologies that we have in the office, that's when you're going to have the best result. Okay, so just keep that in mind. The first technology I wanted to talk about today was the Profound technology. So this is a radio frequency with microneedling technology. It's very different than other devices out on the market. And the reason for that is because it stimulates not only your collagen, but also your elastin and hyaluronic acid in your skin. So we actually can use this device in a lot of different areas on the body, not only the face, the neck, but a lot of body treatments as well. So we do it to tighten and firm up the arms. We do it on the tummy area, on the flanks area, which you'll actually hear Dr. Wilder talk about a little later on and her experience with that. She was just treated yesterday, actually, so she's a little red and bruised today, but no pain, right, Dr. Wilder? No pain. So that's great. So we'll be, so, you know, we can do the tops of the knees. We can do the thighs and the buttocks area. So this is phenomenal to not only smooth out the cellulite, but also to firm up and tighten the skin at the same time, okay? So a lot of other devices don't do that. They don't do the two together. The Profound radio frequency with microneedling technology can actually go in subcutaneously, and what it does is it takes that subcutaneous tissue where that cellulite is, and essentially we create little micro injuries in the skin. And when we do that, It's going to increase that dermal thickness, or the thickness of your skin in that dermal layer, right? And then it also remodels where the cellulite is, so it gives a much more smooth appearance. And it decreases that adipose volume as well. So it's pretty significant. I can actually speak for it myself. So I had the back of my thighs done last year. And I would say I'm a grade 2 with the cellulite prior to the treatment. I would say now I'm a grade 1. Okay, so that gives you a realistic expectation. Is it completely gone? No, but is it a significant improvement? Yes, absolutely. Hands down, I would say I probably got a good 60 to 70% improvement in one treatment. So I'm thrilled with that. And a lot of the patients who do it are thrilled with that. It's realistic expectations. You know, we don't want to have in our mind that we're going to look like we did when we were teenagers, right? It's just not the way it works. But we can certainly strive for the best outcome and natural outcome, and kind of age gracefully is what we like to call it. So realistic expectations are important, but it really, really does work well. For my experience, when I did my thighs, I found it actually very easy. I will say I did have the Pronox laughing gas that we have in the office, so that it really kind of takes the edge off. And the beauty of that is that you can drive home afterwards. It wears off in just a few minutes, and it's very safe. So that's always an option too. So I will say I had that when I had the treatment done. So I felt no pain. And then afterwards, I thought I was going to be a lot more tender and painful. And actually, when everything wore off, the next day it just felt like I worked out my legs in the gym. So it wasn't bad at all. I had a little bit of swelling, and I did have significant bruising though. So the significant bruising for me on the back of my thighs lasted, I would say, about 20 days. So you really have to make sure that you plan accordingly. We certainly wouldn't want to do this treatment on you and then you go on your beach vacation the next day. Okay, so you just have to make sure that we have that realistic downtime and recovery, which is really easy. It just doesn't look so great for a couple of weeks. So Profound RF, again, that's going to remodel and tighten and smooth everything out. And so that's a great one. The second one I wanted to talk about is UltraShape Power. UltraShape Power is ultrasound technology that destroys the fat cells. So what it does is it actually goes down into where you have your subcutaneous fat, and think of it like an explosion of those fat cells, and then all of the debris of those fat cells just gets flushed out through your liver, flushed out naturally over a couple weeks' time. This is the beauty of this, is that it does not see any nerves, doesn't see any surrounding tissue. So that means zero pain. And when I say that, I literally mean zero pain. You will not feel a thing, maybe a little bit of a vibrating feeling. And then you have no bruising, no swelling whatsoever, no downtime, okay? You could literally go to the beach that day and no one would know you had anything done. So that's very different from the other technologies such as cool sculpting or sculpture that is out on the market today, where you do have the, number one, it's painful. Number two, you have the bruising and swelling. And usually it takes a good 2 months for all of that to go away and to start slowly seeing the effects. With UltraShape Power, you can see it in as little as 2 weeks' time. We space those treatments out in a package of 3, and they're spaced out about 2 weeks apart, give or take. Sometimes I can do it once a week, just kind of depends on the schedule. So we just do a series of 3. The reason why we do that is because in the FDA clinical studies, they found that that is where patient satisfaction was, as after 3 treatments. Could you do more? You certainly could. It's not harmful to you, but most of the time we'll just do a package of 3, okay, spaced 3 weeks apart. You will not see the full result of that until about 6 weeks after your last treatment. So it's cumulative. After each treatment, you'll slowly start to see the results, usually after the second treatment, and then it continues after that for about 6 weeks' time. We do have the Fit 3D here in the office, so we like to put you on the Fit 3D device before the Profound and also before the UltraShape Power. So any body contouring treatment that we do, we put you on the Fit 3D device. It literally gives you a 3D picture of your body, and it also takes measurements accurately, everything. So we put you on that device before, and then we usually have you come back for a follow-up a little while after your treatment, so that we can compare the two accurately. So that's also a great tool that we have in the office for all of our body contouring patients. The other thing I wanted to mention specifically for UltraShape Power is, again, realistic expectations and who's a good candidate for that. So the best candidate for that is going to be someone with a BMI of 30 or below, okay? So if someone has a BMI of 32, I'm going to weigh it a little bit, depending on your lifestyle, depending on what you're doing at home. Are you on a regular nutritious diet? Have you cut out alcohol? Do you have a lifestyle where you're not stagnant but you're constantly active? So all of those things are going to play a role into whether you're a good candidate for UltraShape Power and have those realistic expectations. This is certainly not a license to be able to go to In-N-Out Burger after each treatment and, forever after that. It just doesn't work that way. I wish, and if that were true, I'd probably be on my private island with my private jet, sipping a Mai Tai, because I'd be a bazillionaire. We all want that magic pill. It just doesn't happen that way. So we really need to make sure that we're either working with Dana, our in-house nutritionist, who's phenomenal, making sure that we are on track either before we do any of these treatments or even during, okay? And sometimes it's just a tweak of some, maybe your hormone levels are off or something like that. And Dr. Wilder can speak to all of that in a little bit, because obviously she's going to be the expert on how we can incorporate all the different entities that we have here at LifeScape Premier, okay? So I'm going to turn it over to Dr. Wilder now that we've just talked about the Profound RF and the UltraShape Power, targeting cellulite, targeting skin tightening, targeting that fat reduction, and destroying those fat cells. She's actually going to start talking about how does COVID-19 play a role in coming into LifeScape for aesthetic services, what we're doing to enhance our protocols, and then just her own personal experience with doing both treatments. Okay?
Because we know I don't just buy these for business purposes. So I'm so happy to have you guys joining us, and certainly one of my favorite topics, and we are really, really fortunate to have people like Noelle here. Noelle is like one of the lead trainers for Candela Medical, so she is like a national expert training people across the country in things like the UltraShape and Profound procedures. So and we have Charity also, our nurse injector, incredible range of certifications. So they go above and beyond, and to make sure we're doing these in a quality way, and that we're doing it in a safe way, that we're being appropriate in terms of patient selection. When I see negative outcomes out there from aesthetic procedures, the vast majority of the time, the wrong treatment was done or on the wrong patient. If you try to do body contouring and your body mass index is in the obese range over 30, you're going to have great difficulty, and you haven't addressed the root causes of that weight problems. So, again, we're always about holistic approach to problems, including cosmetic issues that we all struggle with. I had treated yesterday those annoying, I call them the flibs and flabs that just, collect over years and years, and COVID has added about 10 pounds of them to my frame. So I'm very grateful to have some of these services available. It would help if I ate less, but I'm also trying to work on that too, and trying to practice what I preach. I also want to just touch on the COVID piece, because our team has gone above and beyond in terms of the safety of our patients. The number one, overarching thing is that our patients are safe as much as possible, and that our staff are safe. We did a staff meeting the other day. I said, how many in this room have a COVID risk factor? It was about 80%. And then I said, okay, if you don't have a risk factor, how many of you live with someone who does? And by that time, it was 100% of our staff. And some of us, and I don't know if Noelle wants to talk about her story, but some of us have had very, very personal experience within our families of COVID. And so we take this super seriously. Medical level, Noelle's gone above and beyond to get certified in infection control and blood-borne pathogen control. So she is beyond educated in all the strategies that we need to do to keep everybody safe. We put in advanced air cleaning, UVC, air filtration in our procedure rooms and in our sick, or what we call our clean rooms. So we don't even bring a sick patient ever into the front of the clinic. So they will never go through the waiting area. They will never be in the lab. They won't be in our restrooms in the front. They will not be in our procedure rooms. If we can deal with sick patients at home, we do. If we need to bring them in, they're brought in through the back to very specific rooms that are handled in a very different way. So I think that it is critical. I mean, if you're going to an esthetician or a place where people are unmasked, where they're not abiding by just standard procedures, keeping it uncrowded, keeping people spaced 6 feet, temperature monitoring, etc., then that's not a place you want to be. Even though our COVID counts, fortunately, right now are very low, that may not stay that way. It could be very easy for it to go back up. And one case can be, several dozen cases in a few weeks and 4 or 5 deaths. So we just don't want to be a part of that. We take it really seriously. So when do we recommend these procedures? Doing the combo is really important, especially I've had 3 children, including twins. So I was the great pumpkin for Halloween almost 22 years ago. And so I have a lot of loose skin and there are those pregnancy things for those of you who have ever been pregnant, that you gain fat in places that just doesn't go away for whatever reason. So I love these procedures because they're so great for those little lumps and bumps, the flibs and flabs that you just, no matter how well you're working out and how well you're eating, they just don't seem to go away. So if you can grab an inch of flab, these procedures will work for you. Now, I've only done the UltraShape, I think, twice, maybe. Every time I always tell Noelle, I get a little fatter and then I go and she nukes it back off, and I get a little fatter and she nukes it back off. But then, I could actually try to prevent getting fatter, but I do love cookies and ice cream.
I was going to say, it's only around the holidays.
I know, it seems to be.
Yeah.
Well, and COVID, like I said. So, that spare tire of stress fat, that's what I'm working on right now. So, the combo is really nice because you get not only, as Noelle described, destruction of the fat. UltraShape Power is the #1 FDA approved non-invasive fat destruction, okay? So it is destroying the fat that it's targeted, but you need a good a laser technician doing this. If they are not targeting it very evenly, you could get uneven fat thing. And especially we see that with cool sculpting patients where they get weird ridges and hyperplasia, actually increasing fat. And so we often have to try to correct that with the UltraShape Power. And then the Profound adds just another level of being able to surface smooth and tighten. So again, those of us who've been stretched out, and sometimes, I was overweight as a teenager too. So I weighed more as a teenager than I did pregnant with twins, if that says anything. But so a lot of loose skin that the Profound really can help tighten up and tone. So that's, the older you are, the harder it is for these things to tighten up. I have looked into mommy makeovers and things like that. And first of all, the cost, is tens of thousands of dollars. The downtime is weeks and weeks. And I have to tell you, I do not like when patients have had the tummy tuck procedure because one, it looks fake. It almost looks like you have a cardboard stomach. People do get into gas bloating problems because they have nowhere to go. If they do get gassy, bloated, distended, there's no place for it to distend except for painfully. And I can't palpate a damn thing on these, excuse me, my language, but you can't palpate anything. So I can't even, as a physician, evaluate the abdomen of somebody who's had a tummy tuck without doing CAT scanning or ultrasound or something else. So I think that's a problematic, and I just was not willing to bear the cost or the downtime or the anesthesia risk, which to me, I've had some problems tolerating, which is why I've created a whole online optimized surgery program. Let me see, what other things do we want to answer? Do we have some questions popping up here?
So let's see what we have in far as questions. I know someone had asked earlier, what is the risk getting aesthetics treatment, specifically Profound treatment or body contouring or facial treatments here versus, let's say, doing some other activities.
Okay.
So
like Botox, like an
injectable,
injectable,
like maybe
or
an injectable. What's the risk factor, COVID factor wise?
Okay.
Getting these treatments done and how. What are your thoughts? Do you think it's safe to do Botox? Mm-hmm. Do you think it's safe to do Profound right now?
So yeah, the safety is kind of look at multiple layers. We know that the amount of time face to face is a potential risk, but again, it depends on how protective, how protected is your esthetician. Does she have the maximal, either the proper masking? Are they using face shields or not? Are they using, as Noelle has, head covers, etc.? The more protected they are, the more the safer you're going to be. Again, the duration of exposure adds some risk, and do you need to be unmasked? Actually, the risk is not so much to you as to the operator. I think, again, with our air filtration systems, which I think add some support, I think that most procedures that we do here are very safe. We are not doing even nebulizer treatments because those could aerosolize virus. None of the aesthetic procedures that we perform at LifeScape have a risk of aerosolizing a virus. Dental scaling with an ultrasonic scaler risks aerosolizing, putting this virus into the air where it could sit in the air. We're not doing anything in this clinic that would have that risk. So I feel pretty safe about it. Doing Profound on the face, again, your face is open, but our staff, for their safety, and yours, are so masked up, gowned up. I mean, I think the biggest risk is that they're going to have a claustrophobia attack and that kind of thing. But
right. I will add too that not only am I taking the necessary precautions here in the office, but I am also doing it outside the office. So you will not see me going to the movie theater this weekend, even though I think they're opening is what I heard. Mm-hmm. You're not going to see me, eating inside a restaurant right now. You're not going to see me in any crowded areas. I've been taking everything, and again, she said, my family's been hit really hard, unfortunately. So I certainly am going above and beyond and making sure that the rest of my family and myself are very protected. And I look at a lot of my patients as family. So we go above and beyond, and not only here in the office, but myself outside the office as well.
And that was the purpose of our staff meeting discussion the other day, was the understanding that what we are doing outside the office puts this family at risk and our patients at risk, and puts our own families at risk. So I think all of us are really trying to be as safe as possible. Let me see.
All right, so let's see. Brenda asks, I've lost 123 pounds and have extensive sagging skin, including turkey waddle. Right. What is the best non-surgical?
Wow. So again, when we have really extensive loose skin, probably the profoundest, and maybe a combination of things. I would say probably a combination of thread lifts, which provide under the skin, I'll call it a scaffolding for the skin, and recreate that scaffolding, and then profound to do that surface tightening. The more loose skin that we have, the harder it may take multiple procedures for that to work. And certainly, our staff would be very honest with people if it's just so extensive that surgery really is your best option. We want people to be happy with their outcomes.
And then let's see what other questions we had. Is a mask required when you come into the office?
Absolutely, yes. Everyone, it's a Maricopa County mandate, first and foremost, and again, for our safety, for the safety of every patient. I mean, like I said, 80% of my staff have a risk factor for severe COVID. So this is, we've seen what happened with the surge in COVID cases, and we've seen that the mask mandate works. So we do request that people have an effective mask. A mask with a valve is not okay. A open bandana, if you come in with a mask that we consider not protective, not sufficiently protective, we will give you a surgical mask to wear while you're in the office.
And then the other question was, does it hurt? Does the Profound hurt? Does the UltraShape Power?
Okay, so the UltraShape Power does not hurt at all. I fell asleep having the UltraShape Power done. Fat destruction. I lost a pant size in one treatment and fell asleep during the treatment. That is how amazing that is. Now, I will say, if you go back to the same behaviors that created that fat there in the first place, which I may have done on occasion, the residual fat cells, we never destroy all the fat cells, even with liposuction, residual fat cells can reaccumulate unlimited fat. So unless you kind of are working on all the pieces of why that fat's collecting, you can regain some weight. So, but yeah, there is no pain whatsoever to the UltraShape Power. The Profound there is some discomfort with you're getting injected with a local anesthetic. We have the Pronox available for people who really want that added help. We have topical. We use a pretty powerful topical to reduce the pain of the injections, and then the procedure itself. Once you're numb, it's really not painful. There may be an occasional time where you'll feel a twinge of heat or discomfort, but it's really not too bad. And then the amazing thing is, Noelle was saying, I'll show you the bruising, which is, looks really much worse than it feels. There is no discomfort afterwards. Mm-hmm. I mean, it didn't bother me last night. I didn't even pay attention to it taking a shower this morning. And my husband's like, what the heck did you do? It looks like you've been beaten with a 2x4, but I'll just show you kind of one, flank. So I was getting these my I kind of got the lower hips done a while back, and that worked really well because that was the stuff that didn't go away with pregnancy. This is the hangover, the shorts, really annoying bulge that, I am T minus 16 months away from my 60th birthday, and I really want to have, I want to have a better body, but I do like my cookies. So,
Marcia asks, what is the COVID risk during recovery from Profound? So,
none. None. There is no increased risk beyond our normal risk of living, which is going to be with us for a while. So really, really high risk patients, this is an endurance event, as I always say. I think right now is kind of a honeymoon period, so I really look at this as kind of the safest time to do a lot of these things. Also, a lot of our patients, are liking doing the things that might cause bruising on their face while they're masked otherwise. So nobody's seeing the bruising or the aftermath. So it's kind of right now is sort of the sweet spot of when it's super, super safe. But yeah, there's no change to your immune system or your immune risk.
Haley asked, how long are the treatment appointments?
So kind of depends on what, how big of an area is being treated, and how many treatments you're getting. So they're very variable. How long did that take yesterday?
A little less than 2 hours.
Okay, so yeah, they're fairly lengthy, depending on what you're doing. I mean, if you're doing thighs, you're doing, we're often doing. We're doing as large areas as we can with the limit. We're rate limited by the amount of anesthesia. We can only use a certain amount of lidocaine per your body weight on you at any given time. So again, we're very careful about that, and that limits the size of treatment areas. Some people wanted to do head to toe 18 areas at once, and we don't have that capability.
Yeah, that just wouldn't be safe.
No.
Yeah.
Unless you're going under general anesthesia, and then you've got the risk of that.
Yeah.
So.
Will it damage my skin at all? So UltraShape Power, the worst thing that could happen with UltraShape Power is a blister. I've actually never had it happen to me, but I have seen it when I've been training other offices that have had it, asking me why it happened. But that's the worst thing that could happen, just as if you wore, high heels on an evening. So that's not bad at all. It doesn't scar, nothing, no bruising, anything like that. With the Profound, if you want to answer that, could it damage my skin at all?
I mean, occasionally theoretically you could have some nerve issues, some numbness for a little while afterwards. We have occasional people, especially up in the face, where you've got a lot of facial nerves, that nerve with the numbing that we do, the nerve blocks and things like that could cause some lingering numbness to the side of the face or the ear, but it goes away over time. We do occasionally see like some milia, little whitehead rashes. I think sometimes we're not sure if that's from the procedure or from the stuff we have you put on after the procedure. But there's really neither of these treatments have scarring, have hyperpigmentation issues. I don't think with a Profound, is that possible?
Profound, it is possible.
Yeah.
But that would be patient selection again, to good patient selection.
Right. Yeah. So yeah.
We wouldn't want to do this on, if you were tan. So if you had tan skin, you run the risk of getting hyperpigmentation or brown pigmentation in the skin. That would fade over time, but we certainly would want to do everything we can to try and minimize that or not have it happen at all. So if you have a suntan, we recommend waiting for that to fade. And there are also creams that we can use to speed up that process to get rid of the suntan.
Mm-hmm. Yeah, I mean, remember, tan is an injury.
Yeah. Tan skin is damaged skin.
I grew up in Hawaii with my Irish Norwegian skin, so I have a lot of injury. But thanks to what these guys do, it's amazing the improvement of my skin over the last decade or so. So, yeah, super fun, these are, great procedures. And like I said, it's only a couple treatments, very, very limited.
How much do the treatments cost?
So again, that depends on the area and the size of the area and how much we're doing. So I don't know if we can even ballpark that easily.
Yeah, did you, if someone had a specific, or I can give you kind of a ballpark, like UltraShape Power, if we were just doing UltraShape Power and we were targeting, a medium-sized abdomen, which would be from the top of the hip bone to the bottom of the rib cage, would be about $2,850, about that. With the Profound, just again a ballpark figure, those treatments start at $3,500 and go up from there, depending on what we're targeting and the size of the area.
And a Profound is usually a single treatment. I mean, if somebody's older, like in my case, if you're close to your 60s or older, you may it may be maybe a 2 treatment process, but like a year apart or 6 months apart at the least, because it's a very Profound is more of a slowly evolving result. So it's not the instant gratification type of thing you might get with a filler or something like that, but really it's so much more lasting. I had a friend who was asking me, what have you done with your neck? And I never even paid attention to my neck, but because of the tightening and stuff that we've done, my genetics would have me be just turkey neck by now. And I didn't even know my neck was that noticeable, but that's one treatment, and those effects are likely to last several years. Again, if you're treasuring your health, if you're eating very antioxidant rich diet, if you're really being diligent about sun protection, if you're hydrating well, if you're not smoking, not overdoing alcohol. Alcohol is the fastest way people regain their belly fat. I will tell you, that is our number one cause of treatment failures is a regular steady alcohol habit. So yeah, if you're doing all the right things, sleeping well, eating well, moving well, and staying out of the sun, these treatments can last for a really long time, and then they kind of add up on each other. So you can look really, so as we're all going for it, which is dying young at a very old age.
All right, I think that's all the questions that we answered, but I did want to just mention that we still have virtual consults available. So we're still doing virtual consults. We always have. So if you're out of state, anywhere in the country, we're able to do those virtual consults. And then also, we are doing a special, which is actually unheard of here at LifeScape, to be honest. So if you text the word LIVE, LIVE, to the number 480-748-3598 by the August 31st, you'll get $500 off when you schedule the combination treatment of the UltraShape Power and Profound treatment. And if you text today, you'll also get a free hydrofacial valued at $295. So the discounts and the promotions only available once the treatment is actually booked and paid for, and it has to be both the UltraShape Power and the Profound. But we'll make sure that we put that in the comments for you if anyone's interested. And again, you get the consultation. You can either come into the office safely to do the consultation or by virtual FaceTime. Seems to work just as well. So whatever you guys prefer. And then I think that's it. So it was fun. Thank you so much. If you have any other questions, feel free to text me, call me here at the office. or email me. We'll make sure to put all that information down in the comments. And the number again is 480-748-3598. All right. Have a great rest of your Wednesday, guys. We'll talk to you soon.